Hey there, I'm super excited that you're listening to this podcast today because most people don't realize how costly cheap hearing care can be. People need to know how they can save their time and their money in order to hear their best. We're just going down that road of what does the patient journey look like? I think that it starts with someone is maybe in denial or maybe aware of the fact that something's changing, but society makes it so that they keep it in a secret. So they're in this like dark world where they're trying to go on their own in secret, figure out how to solve their hearing problems.
The problem with that is when people come into my office and they've been to other places or they've done the shortcuts, they're so disillusioned or they lack so much trust. And I know how to help them. I know best practices. I know what needs to be done, but it takes so much longer and it's so much more effortful to get to the place they need to get to because they've kind of like had these negative experiences along the way.
I agree. I've met so many people who had bad prescriptions,
Yeah.
headaches, can't hear well, they've been struggling. So they've been retraining their brain on something that's wrong. Imagine if someone was like, what's the difference? Here, take these glasses and just wear them. Yeah, you'll have a headache for a few days. Yeah, you're going to be like trying to figure it out. Eventually, your brain will start to try to work with that because you're forcing it to. It's trying really hard, and eventually you get used to that. But if someone didn't set the prescription correctly, I don't care how much the hearing aids cost. If the hearing aids aren't fit with best practices, if real ear measurement isn't done, which unfortunately it's is it the number around 85% of all places that actually dispense hearing aids are not using best practices. No wonder people are frustrated.
I think it's interesting, people don't realize how much goes into a proper hearing aid fitting. It's not like glasses where it's like, oh, everything's fuzzy now, everything's clear. It's like the hoops that we have to jump through. So we need to get the right prescription. We need to get the right ear mold fit. We need to get the right venting. We need to choose the proper product. Like there's so many different, points of the journey where it can fail. And if you are not finely attuned to it, or if you're not detail oriented, you're not following every step, that hearing aid can end up in the drawer so easily. So people are like, yeah, I've had a hearing aid. It's been in the drawer for 4 or 5 years now because one really important step was missed.
It doesn't take that much time or effort to save not only the patient's time, but our time, right? If we get the configuration right, let's say your canal has this unique bend and we need to bump up like the lows and decrease the highs because you have this peak and blah, 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 and we just make it sound smooth and we can see it on the screen as we're setting the hearing aids. I just saved myself so much time in the clinic with you coming in with complaints back and forth that the things didn't work.
Yeah, and
Yeah.
it's that like coming in and not getting it right over and over that frustrates people, and at some point they
Yes.
give up. I had a young man yesterday. He's 27 years old, and he has such a severe loss, and he's a cochlear implant like a candidate. And
Yeah.
I had to break that to him, and he had been walking around in these hearing aids, and he's like, I don't know why I can't hear with them. Well, like they're entirely inappropriate for you back then and now. And it broke my heart. This is a young man with like his whole life ahead of him who had withdrawn socially, who was like, picking and choosing the places, the friends, the people he hung out with because listening was so effortful. And and yeah, that's what I see in the practice all the time.
We have a patient who she's like 28 years old. She's a medical resident. She's having problems in the morning huddles in the emergency department. She's having difficulties answering the phone. It turns out her story is she was born probably with a hearing loss, not identified until she was like 2.5, 3 years of age, fit with hearing aids right away. Her parents did everything right. She, over the last 5 years, has been wearing hearing devices from a competitor that says that they are the best. She was so underfit, it was disgusting. She had been wearing them for 5 years.
Ugh.
Finally, her mom was like, she listened to a podcast or something. I think it was Juliet Sturkins up in Wisconsin talking about telecoils and all of that. And she contacted her, and Juliet sent her to us to fix their work. And I wanted to cry for her. Her speech understanding ability at best in the better ear was 32%.
Oof.
And you know it wasn't that bad way back when, but
Yeah.
her brain had changed to deal with the reduction in speech access, and then also not a good fit. But they pushed her into the smallest possible, but they didn't do any kind of verification to make sure that she's actually getting audibility. She really just wants to be able to hear.
Yeah.
So then connecting her with like a special app with her special stethosset so she can see the heartbeat and hear it, and just putting together all this stuff that no one ever did for her or with her. And it's not like people aren't educated on this. It's just a matter of, does the business structure of where you went allow time for that extra? Are they all about nope, 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 sell, sell, sell? Or are they caring about the human being in front of them and doing these extra steps that improve their quality of life? Like, I feel like the typical person who has what we call presbycusis, the hearing changed over time, just due to years of listening, if they've already been nervous or they're in denial and they waited years to do something, and then they finally pick themselves up and say, okay, I'm going to do something, and then they go into a place that does not give them the right prescription, and then they work with that for 5 years, we have brain atrophy. And I'm not trying to scare anybody, or like University of Pennsylvania Perelman Medical Center came out with a study in like 2010 where they showed how the brain shrunk in those who had untreated hearing loss. And those who had untreated hearing loss, or they weren't able to hear properly, the temporal lobes actually shrunk. And we want, like you said, we want to be able to stay, like, let's say we meet someone, they have 32%. We want to keep that 32%, if not improve their speech understanding abilities. And so many times when we do the pre assessments and then we do the post assessments, usually we see an improvement. Like,
Yeah.
it's fantastic to see.
It's
And it's like, woo,
measurable.
yeah, high
Yep.
five. So
Yeah.
measurable.
Yeah.
Give this person the opportunity to hear better. So I do fix people's hearing aids all the time, that they got them through their insurance or they were able to, like, it depends on the product. It's definitely possible, but you have to think about the clinician and the time that they're spending with you to get it right the first time. So why not just go to that kind of clinic the first time?
Yeah. That's the $1 million question. Why not get it right the first time?
I would say start with our Entheos list that's on here. Start with those clinicians that are near you,
Yeah.
for sure, because you can at least start that dialogue question. You're going to ask them, any clinic that you go to, do you use real ear measurement? It's a speech mapping system to fit the hearing aids.
I can't tell you how many people have sat in that chair and sat in front of that real ear machine and said, this has never, nobody's ever done this for me. Nobody's ever used this on my hearing aids to fit hearing aids. And it breaks my heart every time. This is the gold standard for fitting hearing aids, real ear measurements.
The clinicians like you, or many of us that are doing it, we're going in curious. We're like, look, we could be wrong, but I'm going to do the best I can. And if I'm wrong and I set this up and I'm like, oh shoot, this hearing aid isn't strong enough for you, let's change that. Oh shoot, we need a different part on the end. We need a more powerful receiver. We go in just finding out how we can help that person best, but the science is there. But it honestly, it takes 5 to 15 minutes to get all of this information and to go, okay, now we have a treatment plan for you. Like, it's not just we fit you with hearing aids. Now there's all this homework. I want you to do X, Y, and Z, but at least I know that I have the prescription started, and we know realistic expectations. And now you have to practice strategy. There's so much more to it than just having something shipped to you from an Amazon driver and you put it on.
So people ask me all the time, where can I go to get services that you provide? And they're not local to me. I trust my colleagues at AskanAudiologist.com. I would always send them, if I could, to those people, to my colleagues. He'll take really good care of them. We're all practicing at the same standards of care.
You can find more information at AskanAudiologist.com, and you can follow us on all our social channels at AskanAudiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.